They say practice what you preach. All right, so I'm outside the restaurant, getting ready to go in the restaurant. All right, and I'm wearing a simple mask. Whoa. Okay, here we go. All right, Fazan, how are you?
Good, how are you?
Good, you're being safe. You have your gloves on.
Gloves
You
and
have the
mask.
N95 mask.
The top of the line.
And I'm wearing the simple mask. So
Yeah.
now I wanted to say that the mask that you have, Fazan, is actually the mask that we wear in the hospital.
Yes, correct.
So if I'm taking care of a patient who has coronavirus, that's the mask that I'll wear.
Correct.
And I'll wear gloves, and I'll also wear
Gloves.
like a gown.
Gown.
But you know what? Your apron is almost kind of like a gown.
Yeah.
Kind of. So that's you're being extreme. You're being almost the same amount of safety that we do in the hospital is what you're doing, because your eyeglasses are also protecting you. So you're doing a very good job. Now me, what I'm doing is, if I'm going into a store, like let's say I'm going to the grocery store and I want to buy some food, I will put this mask on. This is called a simple mask.
Simple.
We made a video with your dad in this one also. The simple mask is sufficient so that, let's just say I had coronavirus, I'm not going to spread it to anybody.
No.
Okay? Or if somebody else has coronavirus, they're not going to spread it to me. Because if I'm just in the store, walking around in the store like this, and I'm walking around and I'm doing my thing in the store, I'm not so close to you.
Yeah.
And so because I'm not so close to you, even if you did have the coronavirus, you're not spreading it so much.
Correct, because I
right?
have a mask.
Because plus you also have a mask. Absolutely right. So there you have it. Actually, that's a great point. So if I have coronavirus, or if you do, let's just say I have it, you're not going to get it. Because
Correct.
if I cough or something, it's protected inside here. And nothing's really going to come out. Nothing's going to go into you.
Correct.
Any other questions or anything you want to say about how you're doing things here at work?
Oh, that's all because I'm always keeping my gloves on. Without my gloves,
Yeah.
I don't work. But
Yeah.
somebody comes in at the moment, I put on my mask. So,
So wait, so you wait until somebody comes in and you put on your mask?
Yes.
Excellent. Excellent, because if you're here, look around. The restaurant is pretty much empty right now. So if you're here and there's nobody here, you're safe.
correct.
Oh, another thing I wanted to notice is that they turned on the fans here in the restaurant. And the fan, was that your idea for that?
Right.
That was your idea?
Nobody else was going to turn it on. Yeah.
Wow. So I believe that the turning on of the fan in the restaurant is a great idea, Fazan, because if somebody comes in with the coronavirus and it comes out even in their breath or if they cough, the fan blows it around, so it's going all around so
Correct.
fast, it disperses it or it spreads it out. So like let's just say that 5 coronavirus particles come out when somebody's breathing, okay? And you're not wearing the mask. And let's just say that it takes 5 coronavirus particles to go inside for you to get sick. If somebody's here, they're talking or coughing, and 5 particles come out, and the fan is blowing, it'll blow 1 particle there, 1 there, 1 there, 1 there. Maybe you'll only get 1.
Yeah.
And if you get 1 particle, you're not going to get sick. So what you have done by turning on the fan, amazing. So we're going to do like a high five without actually touching. Ready? Awesome. Okay, let me just add a few more things to what just happened when I walked inside the restaurant. I do believe that what Fazan is doing in the restaurant by turning on the fans is going to help reduce the chances of spread of anything. I wonder if you're starting to figure things out. I wonder if you, as a viewer, are starting to realize that Dr. Moses sometimes uses very simple English and simple speak, but that he says things that if you pay attention to these things, they're very meaningful. What is that we're talking about right now? Okay, I'll explain it. If you walk into a small place, a small office, and there's no circulation, little to no circulation, that lack of circulation could cause you to be more easily infected by another person who has the infection. Whereas if you walk into a place that has maybe very high ceilings and a lot of circulation, the likelihood of you getting exposed or having enough particles of anything, whether it be strep pneumonia a bacterial pneumonia or influenza or parainfluenza or adenovirus or coronavirus or any of the viruses in such a large place, the total number of viral particles or bacterial particles that you will be exposed to per unit time is going to be very low. And now I'm going to say something that I hope you're paying attention to. Your body's own immune system is able to kill and take care of a small number of viral particles or bacterial particles of almost any type, a small number. However, if you expose yourself to a certain number, if you expose yourself to a large enough number of viral particles or bacterial particles, you will get sick because you will be overloading your body's immune system. And the things that I'm telling you, the things that I'm teaching, are to help you not overload the vitamin C, the sunshine, to make your immune system stronger so that it doesn't get overloaded. This idea of the fan, that's a great thing. Look for that. Pay attention for things like that.